Intrauterine devices, or IUDs, are small, T-shaped devices that are placed inside the uterus to prevent pregnancy. IUDs are a long-lasting and highly effective form of birth control. They are a safe and convenient option for many women. IUDs offer a reversible method of contraception. This means that once removed, a woman's fertility returns to normal relatively quickly. IUDs are becoming increasingly popular as a contraceptive choice. They provide long-term protection against pregnancy, unlike other methods like birth control pills, which require daily adherence. IUDs are also hormone-free, making them a suitable option for women who cannot or choose not to use hormonal contraception. IUDs work by preventing sperm from fertilizing an egg. They create a physical barrier in the uterus. Additionally, some IUDs release hormones that thicken cervical mucus, making it difficult for sperm to reach the egg. IUDs are a popular choice for women who are looking for a reliable, long-term, and reversible form of contraception. It is important to consult with a healthcare provider to discuss whether an IUD is the right contraceptive option for you and to receive proper insertion and ongoing care. They can assess your medical history, address any concerns, and guide you through the process. There are two main types of IUDs: hormonal IUDs and copper IUDs. Hormonal IUDs, such as Mirena and Kylena, release a small amount of the hormone progestin into the uterus. Progestin thickens cervical mucus, making it difficult for sperm to enter the uterus. It also thins the lining of the uterus, making it less likely for a fertilized egg to implant. Hormonal IUDs can last for 3 to 7 years, depending on the brand. Copper IUDs, such as Paragard, do not contain hormones. Instead, they release copper into the uterus, which creates a toxic environment for sperm. This prevents sperm from reaching and fertilizing an egg. Copper IUDs can last for up to 10 years. Both hormonal and copper IUDs are very effective at preventing pregnancy. The effectiveness of IUDs is greater than 99%. This means that less than 1 out of 100 women who use an IUD will become pregnant each year. IUDs are one of the most effective forms of reversible birth control available. They are more effective than other methods like birth control pills, patches, and rings. IUDs are a long-acting and reversible contraceptive option. They offer highly effective pregnancy prevention. If you are considering an IUD, it is important to consult with a healthcare professional to determine the best type for you and to discuss any potential risks or side effects. IUD insertion is a relatively simple procedure that can be done in a doctor's office. The healthcare provider will first examine the cervix to determine its position and size. They will then insert a speculum into the vagina to hold it open. The IUD is then inserted through the cervix and into the uterus. The procedure usually takes only a few minutes. Some women may experience mild cramping or discomfort during insertion. This can be managed with over-the-counter pain relievers. After insertion, it is normal to experience some spotting or light bleeding for a few days. It is also recommended to avoid using tampons or having sexual intercourse for a few days after insertion. Like all forms of contraception, IUDs can cause side effects. Some common side effects of hormonal IUDs include irregular bleeding, acne, mood swings, and weight gain. Copper IUDs can cause heavier periods and more cramping. Most side effects are mild and tend to go away after a few months. It is important to contact your doctor if you experience any severe side effects, such as heavy bleeding, severe pain, fever, or unusual discharge. These could be signs of a complication, such as an infection or expulsion of the IUD. Regular checkups are recommended to ensure the IUD is in place and functioning correctly. IUDs offer several advantages over other forms of contraception. They are highly effective, long-lasting, and reversible. Once an IUD is inserted, it provides continuous protection against pregnancy for several years. IUDs are also hormone-free, making them a good option for women who cannot or choose not to use hormonal contraception. However, IUDs also have some disadvantages. They do not protect against sexually transmitted infections, so it is still important to use condoms to reduce the risk of STIs. IUDs can also cause side effects such as irregular bleeding and cramping. In rare cases, IUDs can also become dislodged or cause complications. IUD removal is a simple procedure that can be done in a doctor's office. The healthcare provider will use forceps to gently remove the IUD from the uterus. Removal usually only takes a few minutes and is typically well tolerated. Once the IUD is removed, fertility returns quickly. For more information about IUDs, you can talk to your doctor or visit the websites of organizations such as Planned Parenthood or the American College of Obstetricians and Gynecologists. These resources can provide you with accurate and up-to-date information about IUDs and other contraceptive options. It is important to choose a contraceptive method that is right for you and your individual needs.